So I'm here on the couch with Caitlyn and Blair, who are the medical students who sit on the board of the Rural General Practice Network. So hey, thank you so much for the work that you do with the network. How long have you been on the board?
We're in our second year of the role now, so we've been in just over 12 months.
Yeah. Yeah. And why did you put yourself forward to be on the board of the Rural General Practice Network? I mean,
For me, it was because I'm based in Auckland Medical School, so I've got quite limited opportunities to contribute back to my own community, which was the West Coast.
Right.
So for me, this was an opportunity to contribute on a national scale to that, where I might not otherwise get that during my studies.
Yeah.
Yeah, and I guess for me, I'd been involved with sort of the Otago kind of rural health club and had a bit of an interest in rural health, and this sort of opportunity came up. I thought, oh, it's quite good to kind of network a bit further and kind of get more of a national representation, which is something, I guess, when we're kind of dealing it within the Otago level, we're like, oh man, it'd be so much better to have more contact with Auckland and other medical students and then sort of nursing students, and it kind of all went from there, and then this ended up being the perfect role to fulfill that, really.
Yeah. And how is the network supporting students currently?
Hugely, really. I mean, this year they've offered the first 40 students who registered for conference got half price entry.
Right.
Of an already hugely reduced conference fee, which was, I think for a non-member it was sort of $900, and they made it $50 for students, which is just And then the first 40 got it for $25, which was all subsidised, and then they offered 10 students a $200 travel subsidy. Which we had sort of over 3 times the number of applications for, and had them all come along, so that was a big thing. And then just the fact that they're so welcoming to students has been huge. I mean, allowing pretty much 100 students to come to conference and specific student sessions. We had a career panel session this afternoon and a breakfast forum on Sunday morning and a student dinner tonight, so it's all sort of student orientated.
Yeah, that's really good. So the network is supporting students for coming to the conference, but you're working sort of month by month with the network. But what other things do you get up to with supporting the network and the work that it does?
So one of the things we've done over the last few months is we're trying to promote rural medicine on the same platform that other specialties are promoted within preclinical lectures.
Yes.
So that's something we've actually put a formal proposal in, Caitlyn and I, with assistance from some of the other board members, to Auckland University in this case, to try and get some more lecture exposure. We're hopeful that will be included in the academic year for next year, all going ahead.
What a great idea.
Yeah, and I guess other things was, a big one that it was a national student task last year was trying to get the 7-year cap on student loans lifted. And, as the network, it wasn't as big as, say, the whole Medical Student Association, but putting our name on that sort of appeal to the government was sort of all that step, and it went out in the newsletter just to let everyone know that the issues that sort of students are facing at the moment. Yeah.
And just tell me the outcome of that.
It was your...
I'm the graduate of us. So the outcome was the government has allowed 8 years worth of student loan funding for medical students, as well as a couple of other longer professions.
Okay.
And the TI grant, which was traditionally paid in monthly instalments, is to be paid to graduates if they wish in a lump sum up front.
Right.
So that will allow those handful that are still not covered by the 8 years worth of funding to pay for their fees up front with that grant.
Yeah.
So ultimately it's been a success.
It's been a success.
Not
well
perfect,
done.
but,
No, and it's so important to be part of the voice that's made those successes, and you really celebrate that.
I would like to think that we had a small part in the machine to
Absolutely.
add to that.
Yeah, no, well done, and thank you again for the work that you do for the network and for the vibrancy and energy of all the students that are here at the conference. It's great. Really adds to the atmosphere and so on. So
Our pleasure.
yeah, thank you.
Thank you.